My name is Sally, and I'm a genetic counselor. This video segment is going to focus in on microdeletions and why you may want to add this type of testing to your prenatal screen. Natera now offers a microdeletion screen as an optional add-on test to the Panorama chromosome aneuploidy screen. Trisomies, or 3 copies of a chromosome, are the most common chromosome problem we tend to see during pregnancy. Down syndrome may be a term you're familiar with and refers to 3 copies of chromosome 21. Microdeletions, on the other hand, are when there's a very small part of one particular chromosome that is missing or deleted. When there's a small portion of a chromosome that is deleted, there can be multiple genes within that small area of the chromosome. Depending on how big the microdeletion is, will determine the severity of the condition and outcome for the child. All women are equally at risk for microdeletions on this screen, regardless of their age. They can affect as many as 1 in 1,000 live births. The microdeletion screen for Panorama includes microdeletions that, when combined together, are more common than chromosome conditions like trisomy 18 or trisomy 13 and have a range of intellectual disabilities and physical conditions. These deletions can occur randomly in egg or sperm. They are usually not inherited and occur brand new in a child for the first time within a family. However, there are rare instances where there can be inherited forms, and you should talk more with your doctor to see if you're at risk for one of those conditions. We have a list of microdeletion conditions that we are including. These microdeletions occur across various chromosomes throughout the genome. They can affect as many as 1 in 1,000 live births. There's a differing incidence, intellectual disability, lifespan, and associated health problems depending on the condition. 22q deletion syndrome, also known as DiGeorge, is the most common microdeletion that we screen for. You will get a high risk or low risk result for 22q deletion every time you order Panorama with microdeletions. Keep in mind there are other things like your family history or certain ultrasound findings that may increase your risk for these conditions and may alter the way that you want to be tested for them. If you're interested in doing microdeletion testing on the Panorama test, make sure to have your doctor specifically check the box requesting this testing. Remember, there are other videos in the series to help you address additional questions that you may have about your pregnancy. I also encourage you to talk with your doctor or healthcare provider to see what testing may be appropriate for you. You can view these videos and additional information by going to panoramatest.com.
These tests were developed by Natera Inc., a laboratory certified under the Clinical Laboratory Improvement Amendments. These tests have not been cleared or approved by the U.S. Food and Drug Administration.